dogs from food stamps. We have an epidemic of obesity, particularly among our poor, particularly among those on food stamps. Why not just take the food formulary and make it healthy food? We do this for WIC. We decided for pregnant women that we do. But I've had a bill out there for quite some time. I have no one from the other side of the aisle, so I'm glad to hear of your concern for junk food and hope I can get you to consider that. We talked about precious resources, and we say, well, gosh, we can't study autism or any, we're done with vaccines. The problem with that is there is a great deal of vaccine hesitancy, and there does need to be convincing. It doesn't mean we need 99% of the NIH budget on autism and vaccines, but certainly I think we have room to have another study to try to convince those who are hesitant. We ought to look at populations of people who take no vaccines, the Amish and others, and try to compare them in a scientific way to those who do and see if we can learn something from that. But one way to have more precious resources directed towards good science is to get rid of the frivolous studies. William Proxmire started talking about this in the 70s. I've been talking about this for a dozen years. This is from the NIH, 2.1 million studying whether or not when you're at the Luby's cafeteria and somebody in front of you sneezes on the food, are you more or less likely to take the food? I mean, that kind of stuff's ridiculous. You could have real science if you weren't doing that. But that's been going on for decades. One of the first things that Proxmire mentioned was a study on what makes people happy. That would be great for Cosmopolitan magazine. I really highly suggest it, but it's a stupid idea for taxpayer money for a study. But that was 30 years ago. One of the ones he hated the worst was what makes people more aggressive, gin or tequila? So they fed half the codfish gin and the other half the codfish tequila, and we all know it's got to be tequila, right? I mean, geez, come on, we don't need to study that. But the thing is, there's lots of frivolous stuff out there, and it gives good science a bad name. I vote for almost no spending up here because it's almost all inflated, but I have voted for money for the NIH. But they've got to do a better job, and one of the things I hope is that you will direct it towards diabetes, heart disease, cancer, Alzheimer's, these big diseases. But I don't think it's just good people. We got to change the way the grants are such that somebody on the grant committee maybe should be from the major 5 diseases, should be on every behavioral study to make sure we're not wasting it on, whether lonely rats use more cocaine than, well-liked rats use. I mean, that was from last year. So what do you think about trying to look at the way we do grants to try to, populate the people on the grants? You said you were on a grant committee to try to populate the grant committees where there's attention being paid maybe to the big 5 diseases, and we don't get lost down a rat hole, so to speak. Do you have any thoughts on that?
Senator, I think that the resources the NIH, the taxpayers give to the NIH are precious. And if confirmed, I absolutely commit to changing the grant committee makeup so that they focus on the most important questions that impact American health. I mean, there needs to be a mix of basic science work, and I'm not a basic scientist myself, but I can understand how some somewhat abstract basic science work can have fun advances. But at the same time, the research should really be focused on making America healthy. That's the mission of the NIH.
You mentioned, and you got cut off a little bit on steroids, but this was a pretty amazing thing during COVID. So steroids are virtually pennies. They've been around forever. They found a 36% reduction in COVID deaths from people entering the ICU. They're either going on the ventilator or almost on the ventilator. There was like a huge death rate among these people. And they found something for pennies that was a cure. And yet, when Dr. Fauci came to this committee in March of 2020, I asked him about using high-dose steroids the way they do for necrotizing fasciitis and other infections, and he said, oh, they don't work, we've tried it. And he was adamant that the steroids didn't work, and it turned out to be the best cure and the cheapest, and yet the knowledge didn't get out there because there was a bias. Do you think that we can change that kind of bias and hear open debate, and that it'll make a difference with disease?
Absolutely, Senator Paul. That was such a signal success of the pandemic, this study. But the shame is that it was a group in the UK that ran that study, not a group in the NIH. That's something the NIH ought to have run with billions of dollars for infectious disease. It's something that is changeable just with prioritization alone. I think we can align the incentives of the NIH so that it looks for those kinds of opportunities, because there's many of them out there.